Welcome back. Did you know that stress is considered the #1 killer disease? In fact, chronic stress has become a public health crisis. Our next guest says he has ways to improve your overall well-being without relying on medicines. Please help me welcome Dr. Adam Rajoulh. He's a board-certified hospitalist who covers multiple hospitals here in the Central Valley. Welcome to the show, Doctor. It's good to have you. I'm glad we're talking about this because we're also including mental health, which has become a huge problem, I think, especially amongst our young people. What does the word healthy mean to someone like you?
Yeah, so when we talk about healthy, it's more than just physical health. Like you mentioned, mental health is very important. Stress, as you mentioned, has become a public health crisis. Some sites, up to 80% of us are under chronic stress. When we talk about disease, the root of all disease is inflammation. Whether we're talking about cancer, infection, autoimmune disease, inflammation is the root of all disease.
But what causes inflammation?
Well, many things cause inflammation. I mean, autoimmune disease, you're born with, you're already at an inflammatory state. But, our diet, we know, impacts inflammation. So, we know eating sugar and eating processed foods, these seed oils, that's going to increase inflammation. We know exercise helps decrease inflammation. Medicines do treat inflammation, but they don't work in all cases in all patients. Sometimes it's a Band-Aid. What's really interesting, there's been a lot of new research and data, even practicing mindfulness, having gratitude, that alone can change the neuroplasticity of your brain.
And how do we do that? Every day, just wake up and be grateful for what we have, obviously. But do we need to write it down? Do we need to? What do we need to do?
Yes, I mean, some people journal. They write everything they're thankful for. It's easy to look at all the stress in our life. We all have stress, but sometimes we need to sit back and be thankful. I mean, they say it's 1 in 400 trillion chance of us being alive. So just being alive is a blessing. I mean, that alone is a blessing. Having a roof overhead, having water. We don't think about things, from our day to day. I say sometimes if you feel like you're going through something bad, a breakup, job change, turn on the news, look what's going on in Palestine. Look what's happening, just all over the world, go to a pediatric hospital, volunteer, and you have kids that are 5, 6 years old that know they're going to die. It's not easy to talk about, but, everything's relative. You have to put things in perspective. Suicide rates are at an all-time high. We have to be kind to one another. We have to, know that everybody's going through a certain battle, and what's amazing is, people that do drugs like cocaine, for example, it increases dopamine and serotonin. Those are like your happy neurotransmitters. We know exercise can affect that, right? That's why you feel great when you get a nice juicy pump. You're like, oh yes, I feel great. But just practicing mindfulness, we've seen data and more research is emerging that alone can increase those happy hormones, and it rewires your brain, which is amazing.
Why do you think it's so difficult for people to be thankful and happy for what they have?
I blame social media. I blame the Kardashians. No, but I mean,
I'm sure a lot of people would agree with you.
It does make it harder because people see how other people are living, and it's most of it's fake, right? It's not the real world. I just think we're in a very high stressful environment. You have inflation. You have the election. It's hard. It's not like it was before 10, 20 years ago.
Yeah, life was a lot more simpler.
More simple, yes, big time. I agree.
Do you think people have chronic stress and not realize it?
Oh, absolutely. I mean, 50 to 80%. That's what the data is showing. 50 to 80% of us are under chronic stress. Yeah.
But how do we know then? How do we know we're suffering from this?
Well, I mean, so just talking to a physician. I mean, here's what I say: if you have a strong family history of mental health disorder, you should talk to a physician. But medicines do help, right? And some of us do need to be on medicines. It's a chemical imbalance in your brain, but not everybody needs to be on an SSRI. Not everybody needs to be on these type of medicines. And there's been studies that show just practicing mindfulness, doing meditation, doing yoga, just being thankful, having gratitude. They've done studies where they compared those patients to patients that took medicines, and they did better than the patients that took the medicines. Wow. So yeah, it's really amazing. Big Pharma likes to, sorry guys, but not sorry. Yeah, Big Pharma likes to push medicines. At the end of the day, it's a business.
To make us all feel like that's what we need, and that's what will help us.
We have to be dependent.
In these last couple seconds that we have, how can you help us? How can you help our viewers out there?
Yeah, I mean, diet's very important. So, people complicate it. Like, should I do carnivore diet? Should I do keto diet? It has to be sustainable. So, increase protein, focus on protein, cut carbs, but it has to be sustainable. It can't be, an extreme diet. Avoid processed foods. Exercise is one of the best things you can possibly do. I really recommend everybody exercises, and then just practicing gratitude on a daily basis. And it takes effort.
Yeah.
I have to put effort to do it. I mean, it's just like anything else. You have to keep going, and it becomes habit.
Yeah, definitely so important, and words to live by. Doctor, we can go on and on and on. Unfortunately, we're out of time, so you'll have to come back to the show, yes?
I would love to.
Okay, thanks so much, of course.
Thank you.
Thank you. Stick around, everyone. We'll be right back.